briefing by reiterating points from yesterday's announcement. To be clear, we're following the CDC's recommendations and recommending that all South Carolinians, including those who are fully vaccinated, wear their masks when indoors and in public settings in areas with substantial and high transmission. And 41 of our 46 counties in South Carolina are at those levels of transmission. We also recommend universal indoor masking for all teachers, staff, students, and visitors to K through 12 schools, regardless of their vaccination status. And this change in recommendations is necessary due to the rapid increase in COVID-19 cases we're seeing, which the CDC says is fueled by the Delta variant. From a public health perspective, this is a disheartening setback, and we recognize that those who made the decision to get vaccinated may feel the same way. But the fight is not over. As a public health agency, we must do what we've always done, which is to follow the latest science. And right now, the science is telling us that the virus is mutating and taking on different forms known as variants. That is why we're seeing increases in cases. In fact, yesterday we reported 1,105 new cases. This is the highest daily case count we've reported since February the 14th of this year. So this past week's total for cases was a 92.6% increase from the prior week. So it has been said before, but this has turned into a pandemic of the unvaccinated. Our recent analyses show that more than 90% of cases and deaths in South Carolina and 86% of hospitalizations are among those who were not fully vaccinated. That tells us that the vaccines are highly effective. So no vaccine offers 100% protection against infection. Breakthrough cases are always expected. But we need the public to understand that the COVID vaccinations are very effective in preventing severe disease and hospitalizations. The vaccines save lives and can end this pandemic. Lastly, I want to reiterate that we are finalizing our school guidance, and we expect to release that in this week. And so, as always, we appreciate everyone's readiness to see the guidance, and your coverage of this important topic is very important to us in general. And with that, Laura, I will hand it back over to you and thank everyone for their attention this afternoon.
Thank you so much, Dr. Bell. We do have several questions, so I'll go ahead and dive in with the first one that we received today. Dr. Bell, South Carolina has topped 500,000 new cases cumulatively, and we are back above a 10% positivity rate. How discouraging is this after watching numbers plateau and then start to decline?
Well, Laura, it's very concerning to see the national and the statewide increases in case rates along with stagnant vaccination rates. So at this time, we need all eligible residents to roll up their sleeves and get vaccinated so that we can get to herd immunity to give us a way out of this pandemic. Again, the 3 available vaccines are safe, they're very effective, and they have reduced the number of cases and hospitalizations and deaths across South Carolina and the rest of the nation.
Thank you, Dr. Bell. California is mandating vaccinations for state employees and healthcare workers, and the VA is mandating vaccinations for healthcare workers as well. Do you anticipate seeing this trend grow, maybe being considered in South Carolina, either as a recommendation from DHEC or a mandate from the governor?
Well, we can't speak to what the governor or the General Assembly will decide. And also, DHEC does not provide guidance concerning requiring COVID-19 vaccinations. Decisions about individual requirements are best determined by employers. But DHEC does encourage COVID-19 vaccinations for all eligible residents.
Thanks, Dr. Bell. So DHEC supports CDC's updated guidance, but state law now prohibits mask mandates in schools. What options do our local districts have now, and what does DHEC recommend?
Sure, thank you, Laura. Local schools can provide masks to students who wish to wear them, and we encourage them to do so. And additionally, DHEC still recommends that all eligible unvaccinated residents get their vaccinations as soon as possible. We are absolutely at a critical point in a race against the rise in cases. And so I want to remind people that depending on which vaccine they choose to receive, it can take up to 6 weeks before someone is considered fully protected or fully vaccinated. And so for that reason, we encourage parents, students, teachers, and school faculty to wear their masks so they can protect each other, particularly if they're unvaccinated. And lastly, we're working with schools on vaccination clinics for students, ideally to get them fully protected by the start of school.
And a couple questions, of course, about the variant, the Delta variant